Yeah, good evening, everyone. And it gives me immense pleasure to welcome you all to this special edition of Fever Foundation, the first ever quiz on exclusively on fever. Thanks for joining in and participating. I just before we start, I am going to tell you some of the rules of the quiz, how it is played. So, can we have the rules of the game, please? So rules include this quiz is for the postgraduate students only. The quiz consists of multiple choice questions. The option to be selected by clicking the button on the text panel. So you have a text panel, you need to click on the text panel. The video that is displayed with the option is only for representation purpose only. You cannot click on the video. Use the text box to answer your question. All participants are advised not to leave this platform, and please do not enter the YouTube, because in the YouTube you cannot enter any option. It's only for view YouTube. You cannot play. So kindly stay on this platform and complete your quiz on this platform only. There'll be 20 questions in the quiz. So please complete all the 20 questions. Once you submit the right answer, it will not be possible to revert it. There is no negative marking in this quiz. The winner will be selected by maximum fast right answer. Fastest right answer will be selected as the, yeah. And if there is a tiebreaker round with 3 questions will be paid and the decide to winner. Even if it's tie, our judges and the quiz master will decide. So it is advisable to use the laptop or desktop for a better experience of this game. And it is advised to participate from a place where you have a good internet connectivity. If found to be any type of foul play, will be automatically disqualified. And you should not use mobile phone for getting answers from any of your colleagues sitting nearby. Fever Foundation is not responsible for any form of the technical error, such as poor internet connectivity, etc. The participation in the quiz implies that participants accept the integrity of these rules. The participants who have given incomplete or inaccurate personal or contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participation in the quiz and the candidacy for the prize. And I just want to inform you all, first and second winners, there will be two first and second winners will be selected, and they will play as a team representing the zone. Today you will be representing the Western zone, and will enter the national level quiz competition, which will be at FEFCON 2022, November 5th and 6th, 2022 in Bangalore. So you will be playing the national quiz representing your zone as a team. Today you will be playing individually, but in the finals you will be playing as a team. And above all, quiz master and the judges' decisions will be final. All of us will be abide by the decision of the quiz master and the judges. So now, with all this, I wish you all good luck and please enjoy as well as learn a lot of things. So I am handing over to our judges and the quiz master to conduct this. Over to you all, sir. Thank you very much. And before I say, I would like to introduce our quiz masters and the judges. So Dr. Chandrasekhara, sir is the very leading rheumatologist, medical director at Chandra Rheumatology and Immunology Center. He's a president of Indian Rheumatology Association. He's a president, General Secretary of Society of Inflammatory Research from 2016. And he is a managing trustee of the Immunology and Arthritic Research and Education Trust and executive editor of Chandra Journals. Sir has been the faculty and the program coordinator for CMD Fellowship in Immunology and Rheumatology in CRICR. And he has several awards and accolades. To name a few: 2015 Sir C.V. Raman State Award for Young Scientist from the Government of Karnataka, State Council of Science and Technology. 2019 IMA Pune Annual Neo Oration Award. 2013 he was given the Oration Award from National Rheumatology Association. 2000 Dr. Malka Reddy Oration Award from the Association of Physicians of India. So he has got several publications, more than 100 publications in the peer-reviewed international and the national journals, and his special interests include autoimmune disease, recurrent pregnancy loss, and silicon modeling. So, Dr. Chandrasekhar sir, it's our pleasure to have you as a judge in this program, sir.
Thank you.
So, can I have the next? Dr. Anupam Prakash sir is another judge with us. He's MBBS, MD, and PGCD in the hospital medicine, PDCDM, professor and head of Department of Accident and Emergency at Lady Harding Medical College and Association Hospital, New Delhi. He's editor-in-chief of Indian Journal of Medical Specialties. He's the associate editor, API Textbook of Medicine, 11th edition 2019, member governing body API 2019 to 22. Currently is the president, Board of Management, Delhi Diabetic Forum from 2016 to 2019. He's the president of Indian Society for Atherosclerotic Research, vice chairman of API Delhi chapter, member of advisory board of JAPI, JACM, Journal of Case Reports, and he is also on the advisory board member of Fever Foundation. Dr. Anupam Prakash, sir, it's a privilege to have you with us as a judge.
Thank you, Dr. Manjula. Welcome everybody, all participants and the co-judges.
Yeah. So we have two quiz masters today, Dr. Gansham Pangte sir, professor of medicine at Lady Medical College, New Delhi, rheumatology and medicine ICU in charge at LMHC, New Delhi. He is a joint secretary for Indian College of Physicians, API Delhi chapter. He is executive member of Delhi Rheumatology Association, ISER. Is associate editor, API Textbook of Medicine, 9, 10, and 11th edition. He's published more than 100 index, non-index articles in reputed journals, co-edited several books, some of them being Pearls of Scientific Paper Writing, Research Methodology, Ethics in Clinical Research, etc. And Medicine, MD, NBE, postgraduate teacher and examination LD, AIMS and Rajasthan. So Dr. Gansham sir, it's a great pleasure and privilege to have you as a quiz master. Welcome to you, sir.
Excuse me, 7:30 and ಬರ್ತೀನಿ.
The next quiz master is Dr. Ramesh Agarwal sir. He is MD, FRCP, UK and FICP, MNAMS. He is presently working as professor of medicine at Lady Harding Medical College and Associate Hospital, New Delhi. He is a recipient of Srimati Pavan Kumari Jain Oration Award for outstanding work in the field of internal medicine. He chaired session and delivered lecture in various national level conferences, namely Diabicon, API DSC, and Epicon annual conferences. Served on the board of management of Delhi Diabetic Forum, has more than 70 publications in the national international journal. So Dr. Ramesh Agarwal sir, it's again a privilege to have you and welcome to the quiz program, sir. So may I now hand it over this session to our quiz master to conduct. Over to you, sir, Dr. Gansham, sir. Sir, you are on mute, sir. Can you unmute?
Thank you, Dr. Manjula and the Fever Foundation team. And I welcome all the delegates for today's quiz. This is a West Zone quiz. This is a zonal quiz, and two participants will be selected from this, first and second participant who wins this zonal round. And they will go to the final in November, which will be held in Bangalore. It's a I think 5th anniversary and 5th time this is being held all over India. And this time it will be in Bangalore. So I welcome all the delegates and students, especially postgraduate. And this is only for postgraduate students. So anyone who is a senior resident or who is not postgraduate, kindly quit the quiz or do not answer the quiz, because even if you win this quiz, you may not get the award and you may not go to the finals. So we will start with, we have 20 questions for this quiz, zonal quiz. And each one will have 4 choices, and one of them will be the most appropriate. The winner will be fastest finger first. So anyone who's clicked any of the 4 options A, B, C, D, he cannot change it. So once you have clicked one thing, it is remains there. You cannot change. So whenever you put the button fastest finger first, it should be correct one. So wait and listen to the question before listening. If you click it, there may be a problem. And before starting, we will show you 3 questions as a dummy question, and we will just read it, wait for 20 seconds, and then we will see what is the answer. And once you are versed with this projections, this dummy question, we will start with 20 questions, and all the question will be put up from our Computer G, which is a software, Genius software. This software is good enough to give you who has clicked at maybe 1 second, 2 second fastest finger first. It will give you within 20 or maybe 40, 50 seconds. And within that time, and we will count how many of the person has given fastest finger first. And it can also detect if someone is Googling around that their laptop and all. It can detect it, and we can disbar that student if something misconduction is happened during the quiz. So we will ask Computer G to put up the first dummy question. We will start the quiz, and we have our judges as Dr. Chandrasekhar, Dr. Anupam, and Dr. Ramesh will be there to guide us during the process if there is a technical glitch. So we'll start the quiz. Question number 1, dummy question. Okay, so India celebrated the country's Independence Day in August 2022. It was 74th Independence Day, it was 75th Independence Day, or is it 76? C option and D 77. Your time starts now. Okay, so time is over, 20 seconds are over. So you have to, I think most of you have already clicked, and our Computer G will be giving the exact answer. And as this, I already told, we have a big question bank, and we also don't know which question is coming next and which will be the final 20 questions. So we all depends on Computer G that how difficult this quiz will be for this zone. So I will request Computer G to give the answer, because I also don't remember that it was 74th or the 76th. So answer is C. So we have an answer that it's a 76th Independence Day, which is held this year, recently, last month only. So we will just see, Computer G, can we have the results? How many of students are given exact C answer? We can have a percentage distribution of these answer to first dummy question. This was a dummy question. You won't get any marks for this answer. So answer,
yeah,
answer
the trick was
that,
yeah, trick was 70 or 76.
Oh,
so
Amrit
they,
Mahotsav was
so
there.
yeah,
Okay,
yeah, but it is not years. It is 75th or 76th. So very trickily the question has been asked. So
okay, Dr. Manjula has already told you that it was Amrit Mahotsav is going on, 75th year is completed, and this was 76th Independence
Sixth, yeah.
Day.
So let's see how they have got, yeah.
How it has gone. So B option. So 78% of the public has given as a B option, while the answer was C. So only 50% of the students have correctly found this. So we can go for a second question. It's again a dummy question. Computer G, can we start the second question? Okay, so India's Prime Minister reintroduces extinct cheetahs on his birthday last week. So it's come with cheetah again. So the cheetahs were brought from which country? Is it A, Nigeria? Is it Namibia? Is it C, Zambia? Or is it Angola? I think your time starts now. Computer G, time starts now. Thank you, Computer G. Very interesting question for a dummy question. I think whoever has read newspaper or even seen WhatsApp or Facebook, he must be knowing. Computer ji, give us the answer. Although most of them, I think 100% will be correct on this. The option which is correct according to computer ji is Namibia. Okay, so we all know it's a Namibia only. So we have brought cheetahs and which are now placed in Madhya Pradesh, and our country is very proud. It's I think more than 70 years has passed since we have these cheetahs in our jungle in our natural environment. So we can
So what
have
is the guess, sir? 100% will answer right. My
yeah,
guess.
chances are very 100%. Last option was difficult. I think this was easier.
Yeah.
Namibia. So answer is B, 60%. So still it's above the 50%. So I think our students are more inclined to the medicine teaching. They are less often involved in Facebook and social media and Twitter. So it's good. I think they will do better in during the quiz or academic thing. So we can have a third dummy question, Computer Ji. Can we start the third question? I think you are now well versed how to put A, B, C, D, and please be on a laptop or a desktop. Who is considered the father of surgery? So this option is there. So there's a option, Yatinder Mohan Sen Gupta. Second is B is Chanakya. C is Chitta Ranjan Das, and D is Susrut. Computer Ji, time starts now. So I think it's a father of Indian surgery, not all over world. And still it's easier. Okay. Time is over. Thank you, Computer Ji. Very valid question. Although we are in a medicine field and still we should know some amount of surgery. So if you read all these, I feel here also a good number of people, I think maybe 100% will give a good answer. Computer Ji, can we have answer D for this or you want to change it? Okay, so Computer Ji also agrees it's D. And can we have the real picture? How many students are able to use their desktop or laptop to correctly the D? If they have any technical problem, they will know it immediately. So I think we are ready for master quiz of zone, West zone, and we can have the option how many have correctly answered. 90%, still 1% or some students are clicking left and right, and maybe. Okay, so we can start the quiz, main quiz, Computer Ji. Without wasting any time, we will start medicine zonal quiz, which is conducted by Fever Foundation, and it's a West zone with 20 questions. And just to stress again, it's the fastest figure first. As soon as the computer starts 20 seconds, you have to answer the question. Computer Ji, can we have a first question? Computer Ji, pehla question. Everyone is ready. We should be, any technical problem is there, we are there to solve it. We can have the exact academic 20 question. Most of the question will be on fever and most likely infectious disease. Okay, so rectal temperature, first question we are starting. Rectal temperature are generally what Celsius higher than oral temperature? Is it 0.1 degree A option, B option is 0.2 degree centigrade, C option is 0.3 degree centigrade, and D is 0.4 degree centigrade. Your time starts now. We are not able to hear music, but time has started. You all have to click A, B, or C, D. Okay, we are not able to hear the sound, but still 20 seconds are over. And here the question was rectal temperature is higher than oral temperature, and by how many degrees? Computer Ji, can we have the answer? 0.4 degrees centigrade. So highest one, the option, correct answer was D option. And there have been studies which suggest that rectal temperature, we usually take peripheral temperature in the axilla, or we can even have a, now scanners are there during the COVID where we can see the temperature on the forehead or hands, but reliability of skin or a superficial temperature is not very good. So usually we rely on oral temperature, and a lot of studies which suggest that real temperature of the body can be detected by rectal temperature, which has a slightly different thermometer, slightly smaller one. And this is the real core temperature we can detect. And studies have shown that temperature difference between oral and rectal is between the range of 0.4 to maybe 0.6. So higher the option, 0.4 is the correct answer. Computer G, can we have the distribution of the answers? How many people have correctly answered the question? Rectal temperature higher by 0.4 degrees centigrade. D option. Computer G, yes. So 38% of the students have correctly answered the rectal temperature. And here we can see that still we need to it's true that very few centers have rectal temperature. These thermometers are slightly expensive and only used in some big ICUs or during a research purpose when we have a study in which you really need to know the core temperature, or maybe patient who are being treated for hypothermia and where temperature regulation is very important, maybe a transplant surgeon's ICU. So Computer G, can we have the first questions winner, fastest finger first, who won first question? So we have Dheeraj Kotwani, who has won first question, and he has answered within 2 seconds. It's great. I think 2 seconds just before, I think as soon as the timer has set up, he has clicked the answer. Congratulations, Dr. Dheeraj. Computer G, can we go to the second question? Okay, second question is body temperature is controlled by the hypothalamus. Oh, and damage to hypothalamus most commonly cause what kind of temperature discrepancy? Subnormal temperature, A option. B option is supranormal temperature. C is neutral temperature. And D is none of the above. Your time starts now. Thank you. Time is over. So we have a question where we have asked that what is the role of hypothalamus, and if it is if there is a dysfunction of hypothalamus, what will happen? So is it temperature will be reduced or temperature will be increased, or a supranormal temperature, hypothermia may occur, or there may be no change of this? So there has been studies which suggest that hypothalamus has a role in regulation of temperature, and whenever there's a reduction in temperature or patient's body become cold, it can sense from the peripheral skin, and it can raise the temperature by maybe a muscle contraction and all. So Computer G, can we have the answer? Okay, so subnormal temperature, A option was the correct option, because this suggests that if hypothalamus is dysfunction because of vascular cause, or there may be a traumatic cause, it will lead to that muscle contraction, which is controlled by hypothalamus, involuntary contraction, which will be absent there. And this may lead to a subnormal temperature, and patient may have a complication due to hypothermia. Computer G, can we have the distribution of how many students have really given the correct answer? So first option, 40%, good. So almost 50% of the students have correctly know that the hypothalamus has a role, and all of the D option was correctly guessed by the students. And Computer G, can we have the winner for question number 2? And it's Aman Pandey. Congratulations, Dr. Aman. And he has just answered within 5 seconds. So maybe we are giving 20 seconds. It's a longer term. Just to save time, maybe during finals, we can have a 10 seconds is good enough for answering this. Congratulations, Dr. Aman. Computer G, we will go to the third question. And if I am very fast, just let me know. Judges are there. If I am speaking very fast, we can slow down the quiz. Okay, so we'll start with third question. Pyrin protein encoding gene responsible for familial Mediterranean fever is located on chromosome. Chromosome number 12, A option. B option is chromosome number 16. C option is chromosome number 20. And D option is chromosome number 8. Your time starts now. time is over. So I think most of you people have, it's a difficult question. It's a genetic question. And I know that clinical medicine, very few genetics testing is done. So it's not as such, and disease is also not very common in Indian setting, and very few cases has been reported. While this disease is more common in Mediterranean area and some European countries as well as Middle East, it's very common fever. And I personally feel next decade will be a genetic medicine. If we know that what chromosome is involved, we can have a specific curative therapy for that. So Computer G will tell us is option A is correct or not. Computer G, can we have the correct answer? Computer G. Okay, it's Computer G has given answer 16. So familial Mediterranean fever, I think Dr. Chandrasekhar is with us. He can add up with for something about familial Mediterranean fever. And there's a gene on chromosome 16, which is involved in familial Mediterranean fever. And it is an autoinflammatory syndrome in which, as such, there's no autoantibodies. We usually call it an autoimmune disease. But as such, there is no antibodies formation in this. We don't have any ANA ANCA positivity in this disease. And
it is
Dr. Chandrasekhar, can you add something?
Yeah. It is basically due to the instability in the inflammasome as a result of IL-1 and other secretion pathways. They secrete pyrogen in excess with unregulated inflammation, which is responsible for most of its clinical manifestations. So the mutation is at the chromosome 16. Actually.
Okay, so it's a chromosome 16, and this familial Mediterranean gene usually lead to formation of pyrin protein, which is involved in fever in this case. Computer G, can we have the distribution? How many correctly answered option? Okay, so 63% of the students have correctly answered. I'm really impressed. So 63% really know that there's a gene involved in chromosome 16. And but the winner of this question will be fastest finger first. So within 3 seconds, Dr. Sai Prasad Janardhanan has the winner of third question. So now for first 3 questions, we have 3 winners. So I think it will be again a tiebreaker at the end of 20 questions. Congratulations, Dr. Sai Prasad. Difficult question, but correctly answered in time. We can have the 4th question, Computer G. Okay, so here we come the question on question number 4 on the motile zygote of Plasmodium is found in. Is it A, human liver? Is it B, human RBC or a red blood cells? Is it C, salivary glands of the female Anopheles? And is it D, the gut of female Anopheles? Your time starts now. A, B, C, D. Okay, so time is over. Computer G has closed the answering platform. And here 4 options are there. We have to remember the Plasmodium cycle, and in which mainly female Anopheles mosquito is the blood sucker, which is involved in this Plasmodium life cycle. And female Anopheles and these mosquitoes are the definitive host for this, because sexual cycles happen in these female Anopheles mosquito, and they're only during sexual cycle some of the these zygotes and gametes, they transform and become ookinite, and they may become a motile. So Computer G, can we have the answer? Human is a okay. So answer option is D. So gut of the female Anopheles, where there's some motile zygotes are there. They move from the stomach of the malaria parasite, move from the stomach of the Anopheles mosquito and goes to the salivary glands. So option C is not correct, which is non-motile, and this is the motile one. So we can have the percentage distribution, Computer G. How many correctly answered option D? This was from infectious disease, and 60% of the students have correctly answered option D, which is female Anopheles mosquito. Computer G, can we have the Winner also for question number 4, Aman Pandey. Congratulations, Aman. So Aman has leading. I think he was the first answers winner also. So 2 wins for Aman. So he's leading quiz for West Zone. Congratulations, Aman. We'll go to question number 5. Computer ji, can we have the 5th question? Okay. So this is again on fever. There's a severe fever with thrombocytopenia syndrome, which is also called SFTS, is caused by, is it dengue virus, or is it Debbie Banda virus? Is it malaria parasite, or is it coronavirus? Your time starts now. Thank you. Slightly difficult questions. Severe fever with thrombocytopenia. I will also ask Computer Ji to give the answer. Then we can discuss, is it dengue, malaria, Debbie Banda virus, or a coronavirus? Computer Ji, can we have the correct answer? Okay, so answer is B, Debbie Banda virus. I think that it's a severe fever with thrombocytopenia, while dengue, if we recollect, dengue has most of the patients are asymptomatic and they don't even get tested for thrombocytopenia. They have fever for 2-3 days, and most of the time fever thrombocytopenia is not severe. Usually we take counts of platelets less than 50,000 as severe thrombocytopenia. So dengue option was out. Malaria, nowadays a good number of patients of complicated malaria is seen in India. Even Vivax malaria causes thrombocytopenia, but it is also not very common. So Debbie Banda virus has been associated with severe fever with thrombocytopenia, and there has been some cases in, I think, China, where this virus is also called SFTS virus, and it has been associated with severe fever, thrombocytopenia, and good number of mortality. Luckily, it has not spread out of the China. Computer Ji, can we have the distribution of marks? Okay, so option B was the correct answer, and dengue was not the answer. It was a dummy for thrombocytopenia, but not all patients have severe thrombocytopenia. So can we have the winner for this question number 5, Debbie Banda virus or a SFTS virus? Computer Ji. Aman Pandey. Oh, congratulations, Aman. This is a third win in 5 questions, and this time you have taken 7 seconds. Good. Congratulations, Dr. Aman. We will go to the 6th question. Computer Ji, can we have the 6th question now? According to Yamaguchi criteria for adult onset cell disease, all are major criteria except, you remember, except persistent fever, B is arthritis, C is sore throat, D is leukocyte. Your time starts now, and question is except. It's a tricky question. Thank you, Computer Ji. So time is over. There are 4 options for Yamaguchi criteria. We have seen a good number of adult onset cell disease. These patients are young patients which come with rash, and they may have a very high TLC count. They have a neutrophilic leukocytosis, and most of the time they have received multiple antibiotics, but they don't respond with antibiotics. So whenever there's a neutrophilic leukocytosis, evanescent rash which goes off after the fever, and patient doesn't look very sick, you should, and neutrophilia more than 10,000 TLC count, you should keep option of adult onset cell disease. And out of 4 criteria, all are major except for 1. Computer Ji will tell us which is the option which is except, not in the major criteria for Yamaguchi criteria. Computer Ji, can we have the answer? Okay, so sore throat is not the criteria under the Yamaguchi. It's a minor criteria. Dr. Chansekar, if you want, you can add something or more about adult onset or more criteria like 40 criteria, if you want to tell something.
I think you have almost explained every bit of it. Any patient who presents with evanescent rash with a joint pain, with leukocytosis and fever, especially persisting fever or spikes of fever, with absent of ANA and rheumatoid factor, which also could be a requirement. In addition to that, a very high ferritin levels, etc., gives you a clue to a suspicion possibility of adult onset Still's disease.
Thank you, Dr. Chandrasekhar. We have some expert now. We will take help of Dr. Anupam and other experts also. And Computer, can we have the percentage distribution? So question 6, option C was correct, 51%. Very good. I think they have read about Yamaguchi criteria. And can we have the winner for question number 6, Computer Ji? Okay, so we have a new winner for question number 6, Dr. Sonak Lohite. Congratulations, Dr. Sonak. And he has answered 4 seconds. So I think he is good in rheumatology. I think we will have few more questions on rheumatology because this quiz is for fever, unknown cause of fever and infectious disease. We can have a 7th question, Computer Ji. Congratulations, Dr. Sonak. So we have 20 questions. We'll start with 7th question. 7th question is, the following are indication for cardiac surgical treatment in patients with infective endocarditis where surgery to be strongly considered for improved outcome. So it's an absolute indication. Staph aureus infection with intracardiac complication of prosthetic wall is the A option. B is very large, more than 30 mm vegetation involving the native wall is B option. Is it persistent unexplained fever more than 10 days in blood culture negative endocarditis involving native wall, and paravalvular extension of infection with abscess, fistula or heart block involving either native or a value of prosthetic value wall. Your time starts now. Indication for surgery of wall. Thank you. His time is over. So Computer Ji has closed the answering option. So out of these, which is the absolute indication for surgery? Computer Ji, can we have the answer? It looks like D because it is the abscess is formed there. Okay, so answer D is correct. As per it is clearly written that it's a paravalvular extension of prosthetic or a native wall. So if there is an abscess formation, if there's a fistula and this wall is unstable, and sometimes this may lead to heart block also, should be a absolute indication for going for surgery, not waiting for any antibiotic to respond. We have more experts, Dr. Anupam sir or Dr. Ramesh sir. If you want to add something, you are always welcome, sir. Till that, Computer Ji, can we go ahead with the percentage distribution? How many correctly answered option D? Answer D is 48%. So correctly, out of 50% of the students are correctly answering most of the questions. So it's good. And it was a difficult surgical question. And we have a winner, Dr. Tejaswi Javare. And she is another new winner for question number 7. And we still have 13 more questions to go ahead. Computer Ji will go for the question number 8. These all questions are put by Computer Ji. We have a big question bank, and Computer Ji will go for the question number 8. And randomly, Computer Ji is selecting the question. And this quiz is for West Zone, and winner will go to the finals in Bengaluru, November 5th conference. Computer Ji, can we go ahead with question number 8? I think Computer is just thinking what question he should put. Okay, what is the incubation period for genital ulcers Computer G, there's a problem. We can have a screen share from Computer G. Okay. So what is the incubation period for genital ulcers in sanchroid? Is it 2 to 7 days? A option. B option is 1 to 14 days. C option is 9 to 90 days. And D option is 3 days to 6 weeks. Your time starts now. Thank you, Computer G. Your time is over. The question was, sanchroid is the infection caused by lymphogranuloma vulnerem. It's a large ulcers in the genital region, which are very painful, and usually it's come in STD. So more of a disease which is more commonly seen in dermatology practice, but still because it causes a lot of pain, and a lot of patient may be having a other STD or maybe a HIV positive also because of these have a exposure risk or multiple sexual partners. So which was the option? Computer G, can we have the answer? A, B, C, D. Okay, so answer was 1 to 14 days. So any person who has got an infection within or a sexual contact within 1 to 14 days with a patient who is infected with sanchroid or a lymphogranuloma vulnerem can develop sanchroid ulcer in his own genitals, and treatment is ceftriaxone is very effective drug, and beta-lactam can be used in this drug. Even single shot is good enough for treating these sanchroid ulcers. So we have to diagnose these cases and take good sexual history also whenever we see these STDs before sending to maybe a dermatologist for further treatment, because syphilis and other diseases are also commonly seen in these patients. Computer G, can we have the percentage distribution? Okay, so good, 36%. Majority of the students have correctly answered. Answer was 1 to 14, option B. Computer G, can we have the winner for question number 8? Okay, so we have another new champion, question number 8, Dr. Asmeet Chawla. Congratulations, Dr. Asmeet. He has taken just 7 seconds to answer this question. Thank you, Computer G. We'll go to the question number 9. We still have 12 questions left to decide who's the winner of West Zone. Question number 9 on screen, Computer G. All are true for Kyasanur forest disease except, question has except Hartrix Haemophilus spinigera acts as a reservoir, A option. B is KFD or a Kyasanur forest disease virus is a member of virus family Flaviridae. C option, disease is endemic to South Asian countries. And D, person to person transmission is common. Your time starts now. And it's an except question. All are correct except one. Time is over. So Computer G has given a question, Kyasanur forest disease. And in medical practice, MCQs, the standard teaching, what we teach in medical college, we usually say we should avoid question in which negative stem of the question is negative, except and all. We should give a positive question whenever we are asking or assessing the students. So all of them are correct except for one, which appears to be, Computer G will tell us. Sir, Computer G, can we have the answer? Okay, so Computer G has suggested that D is the most appropriate answer. It's Kyasanur forest disease. Kyasanur forests are located in Karnataka. Few years back, or maybe a decade back, a good number of cases has been seen in Karnataka near Mysore. And heart ticks are one of the reservoir for this. Monkeys got infected with this, and KFD virus is part of the virus, which is correct. And only good thing was there was no person-to-person transmission, which is seen in COVID infection during this COVID. And we were all had to wear N95 mask, and we have to cover our face with mask. So good thing was no person-to-person transmission was there with KFD, and only person who got contact with forest animals or tick bite got this Casanova forest disease, which is fatal in good number of cases, 15 to 20 maybe percent. Computer G, can we have the screen for percentage of correct answer? Okay, so good. So answer was G, and good number of students, 82% has correctly answered. And can we have the winner for question number 9, Computer G? I will request Dr. Majula, she's from Karnataka, and our micro team is from Karnataka, Dr. Jairaj and all. If you have heard about KFD on recent surge, students will like to hear about this. It's a good, important for Indian students. KFD, Karnataka disease. Computer Ji, can we have the winner? Okay, we have another new winner, Dr. Shahana AL, who has won question number 9. We are, our Computer Ji is just assessing how many fastest finger first has been done by these students. I think Dr. Aman is still at the top with 3 answers. And Dr. Majula, Dr. Jairaj, will you like to add something on KFD as endemic disease to Karnataka? Or maybe Dr. Krishna?
Yes, sir. Yeah. Sir, yes. Actually, this was the Casanova forest is one of the reserve areas in Karnataka, where it was identified in the year 1957 from the sick monkey in the Casanova forest in Karnataka, which was erstwhile Mysore state. And the reports also date back that almost around 400 to 500 cases were reported then. And also the heart ticks are basically the reservoir of KFD virus, as all of us we know and we study in the books. And these were the things, and I've also seen in rodents, shrews, and monkeys, which were the common host for the KFD virus. So this is the background. And of late, it was
no
reported.
Recent surge.
Yes, sir.
Okay.
Yes,
so
sir.
No recent. Dr. Majula want to add something, I think.
Is available, sir.
Okay, so there's some technical issues. Computer Ji, can we go to the another question? Continue with West Zone.
No,
quiz.
I just because my internet is very bad.
We are not able to hear clearly. I hope I am audible.
Yes, sir, you're audible, sir. Yes.
You're audible now. Okay. Dr. Majula want to add something? Maybe she can talk with the video off.
No, sir, I was talking that no, we have a vaccine which is usually used, if that vaccine is used in the endemic area, so it's a preventable with the vaccine availability here, especially in that particular area of Mysore, which is very common.
So good thing is there, we have already discovered the vaccine which is effective, and Dr. Majula has already now told that around that forest vaccination is going on, and maybe that is the reason we are not seeing more cases of KFD. Thank you, Dr. Majula. Thank you. We have good experts who have with local knowledge, and they are at the site of these diseases which has been discovered. We will go to next question, Computer Ji. We'll like to have the next question on screen. Dhanyawad, Computer Ji. A patient being treated for lymphoma with high-dose corticosteroids who presents with fever, cough, and shortness of breath, and time starts now. It's an easy question, I think. So time is over. There were 4 options. This patient is a immunocompromised patient, lymphoma patient, and he's on high dose steroid and most likely more maybe on a chemotherapy also. And he has fever, cough, shortness of breath, X-ray, and bilateral interstitial infiltrate, which is classically seen in pneumocystis pneumonia. So most likely answer will be B. Computer G, can we have the correct answer? Okay, so it's a PCP pneumonia. Recently, pneumocystis carinii name has been changed. It has been now called pneumocystis jirovecii. So we are still using the old nomenclature, but doesn't matter. This infection is very common in these immunocompromised patients, and these patients may come with these bilateral infiltrate on a lung involvement, and treatment is with Septran and with involvement of this lung with bilateral alveolar infiltrate. We may also have to give a steroid for a month or so. So, Computer G, can we have distribution of correct answers? PCP pneumonia B is the correct answer. Lymphangitis is also commonly seen in cancer patient, but it may look like a bilateral infiltrate, but it's a non-infectious disease and doesn't come with this classical picture of fever and cough. Computer G, can we have the percentage distribution? Any of the expert want to add something? You are all welcome, sir. Till Computer G does the scoring and give us the percentage distribution. Nocardia is another atypical infection commonly seen in immunocompromised patients, and these are AFB positive patients, while PCP is PAS positive, and you can detect this PCP in sputum sample or a bronchial alveolar lavage to detect PCP pneumonia. And Legionella is the bacterial infection commonly seen in air conditioner, commonly seen in the good conference setting where these air get contaminated by wet air. Computer G is taking some time to check who is the winner and what is the percentage distribution. Can we have the answer, Computer G? Okay, so 43% of the students, majority have correctly answered PCP pneumonia. And as time has a good number of time is taken by our Computer G, maybe it's busy in detecting who all are Googling the answers. It is taking time. Maybe we will have to increase the memory of our Computer G. Computer G, can we have the winner for this question number 10? Good thing is, question number 10 winner is, I think Computer G is just given A. Okay, it's a Dheeraj Kotwani. Good. So we have a winner for question number 10, Dheeraj Kotwani, and he has answered correctly within 4 seconds. Congratulations, Dr. Dheeraj. We're still in the halfway stage only. We have completed 10 questions. You have a chance of winning this quiz, journal quiz of Fever Foundation. We'll go to the question number 11. It's a fever quiz. Questions are regarding fever and infectious disease and some autoimmune disease. We have expert panel here, Dr. Chandrasekhar, Dr. Anupam, Dr. Chandrasekhar, Dr. Manjula, Dr. Karthik, and Computer G is the most senior most expert here. And he will give you the question number 11 from his big question bank. Computer G. Great. So question number 11, it's a 19-year-old female presented with a history of fever for 5 days, headache, retroorbital pain. This is the diagnostic thing for 3 days. Patient has vomiting and abdominal pain for 3 days. And investigation shows total TLC of 3,500, which is reduced. Hemoglobin of 15.5, which is slightly raised for a female, Indian female, and PCV of 45. Platelet has reduced. What is the most likely diagnosis? Hepatitis, scrub typhus B, C is enteric, and D is dengue. Your time starts now. time is over. And here, this is another case of thrombocytopenia. You can see it's a female, and although we have not given the location where this patient belongs to, but likely we will take it as an Indian patient only. So classical finding is fever and a retroorbital pain, which is commonly seen in Indian setting in a dengue patient is common here. Thrombocytopenia also fits into dengue. PCV raised. If I would like to advise our postgraduates that most important test for dengue is PCV or a hematocrit instead of platelet. We all in a because of media hype and because of so many misconceptions, we all run for platelets. We start treating platelets. We are start taking random donor platelets are infused without any indication. So most important thing is there's a capillary leak in dengue fever, and this capillary leak will cause hypotension and multi-organ failure, while platelet transfusion is rarely required and only to be given if platelets are less than 10,000 or person has thrombocytopenia with active bleeding. So you should all remember PCV is important. This is thing to be monitored in dengue patient instead of running for platelets count and treating according to platelet count. So I feel answer should be D in an Indian setting. Computer G, 88% of the students have correctly answered dengue. Very good percentage. I think this was the maximum correct answer we have seen. Question number 11. Computer G, can we have the winner also for question number 11? Winner for question Dheeraj Kotwani. Okay, congratulations, Dr. Dheeraj. Within 3 seconds, he is correctly answered, and he is again a winner for more than one time. So our computer and our Fever Foundation team is calculating who are the fastest finger first for this quiz, and whoever has the maximum will be the winner. We'll go to question number 11. Computer Ji, हम 12 number question पे चलेंगे अब next without wasting any time. Congratulations, Dr. Dheeraj. So question number starting of antifungal treatment not required in which of the following condition? Absolute neutrophil count is more than 1000 per cubic millimeter. B is persistent or non-resolving neutropenia on 7th day of antibiotic. C is fever persisting after 7 days of starting antibiotics. And D is high-risk febrile patient after broad-spectrum antibiotic. Your time starts now. Thank you, Computer Ji. Your time is over. And there are 4 options for starting of antifungal treatment. And you can see here that it's all empirical treatment. If you have a culture positive for any fungal infection, you will give antifungal even on the first day. But whenever you don't have a culture positivity and patient is running fever and he's immunocompromised, you do give antifungal treatment. But most important thing are in these patients are one is absolute neutrophil count. Is it usually less than 1000 or maybe 500, or a patient who has ANC is on the reducing trend, maybe post chemotherapy or maybe organ transplantation. So I think A option is first. We should keep it. We should have kept it on the lower side. So I think answer should be A. Computer Ji, can we let us know what is the answer? While rest of the answers were persistent non-resolving neutropenia on 7th day of antibiotic. So whenever we have these immunocompromised patients, we start with anti-pseudomonal coverage antibiotic, and then when they doesn't respond, we add a MRSA cover with maybe vancomycin or any other MRSA antibiotic. And by 7th day, usually most of the ICU has a protocol to start antifungal treatment. So B is correct. And only thing is in this is not the indication. So answer A was correct, or incorrect. You can say should not be started only when antifungal should not be started when ANC is more than 1000. It should be less than 1000. So 38% majority of students correctly answered. And can we have the winner for question number 12? Okay, Dr. Sonak Lohite, I think he's also second time winner at least for this quiz. Within 4 seconds, he's correctly answered. So we are over out of 20, 12 questions are over. And we can go for the 13 number question for our West Zone zonal quiz or Fever Foundation. Computer G will go for question number 13. This is question from the immunology or rheumatology. P-ANCA positivity is specific for which disease? Is it SLE? Is it microscopic polyangiitis? Or is it granulomatous polyangiitis? Or is it IBD? Your time starts now. Time is over. Thank you, Computer G. So this question belongs to, it's a P-ANCA is a type of test, or we call it perinuclear ANCA. It can be done by ELISA method. It can be done by immunofluorescence method. And it is usually seen in a lot of, maybe most commonly seen in vasculitis. So options were SLE, systemic lupus erythematosus, microscopic polyangiitis, or a MPA, or a granulomatous polyangiitis, also called vaginous granulomatosis, or IBD, inflammatory bowel disease. Computer G will give us the correct answer, and we can have Dr. Chandrasekhar on board for autoimmune disease expert. So it's a microscopic polyangiitis, or option B is the correct answer. Dr. Chandrasekhar, will you like to add something if you are there?
Yes.
Yeah,
Thank you, sir. Actually, we need to be clear that given the choice, the P-ANCA, when it is positive, you can best choose microscopic polyangiitis. But P-ANCA could be positive also with even sometime non-specific. So what we here, you have to be very choosy in your thought process. When you look into P-ANCA, what is the possibility of within the option? The best option would be is to go for microscopic polyangiitis. Unless like C-ANCA, where we can be very sure of vaginous or granulomatous polyangiitis, P-ANCA's specificity is little not so precise as much, but given the choice, among the choice, the best choice should be microscopic polyangiitis.
Thank you, sir. So sir has correctly said it's a microscopic polyangiitis. And so patient, you should not do all patient who had fever go for a ANCA test. It should be done in appropriate clinical setting. So patient who are having a who has infection has been ruled out, and you have a persistent fever, you have features of vasculitis in the systemic feature like weight loss, you may have a skin rash involvement, you have a renal involvement in the form of glomerulonephritis, or you have active sediments in the urine. There you should go for a P-ANCA test or an ANCA test. Not randomly, all fever should not go for a blanket testing. And correctly, 59% of the students have correctly answered P-ANCA as a microscopic pan. And we have the winner for this is a difficult question. I think it's a exit exam for MD. Exit exam. This can be an MCQ for them. So we have another new winner, Dr. Ajay Mohan, who has correctly answered in 4 seconds. Congratulations, Dr. Ajay. We'll go for the question number 14 for West Zone Fever Foundation quiz. Computer G, can you just show us the screen for question number 14? Congratulations, Dr. Ajay Mohan. So question number 14. What is the antibiotic coverage of choice to be initiated in patient of high risk of febrile neutropenia? So again, another febrile neutropenia is there. Is this anti-pseudomonal beta-lactam? Is it B is IV fluoroquinolone? C is aminoglycoside, or a D is vancomycin? First antibiotic start. Okay, your time starts now. Time is over. So the question was, what is the antibiotic coverage of choice to be initiated in patient of high-risk febrile neutropenia? You all know that all of these antibiotics are used in febrile neutropenia patient, but it all depends which one to be started first. So, and we have to select the appropriate answer. As per this, I think first antibiotic is started is anti-subunal antibiotic beta-lactam A should be the correct answer. And in some cases, according to situation, aminoglycoside, which are also good anti-subunal, are added. But the main drug which is effective in these patients are anti-pseudomonal beta-lactam, which we should all remember. These are like ceftazidime, it may be a cefoperazone, and even we can use monobactam like meropenem, imipenem, or a piperacillin tazobactam. So these beta-lactam should be used initially, and if they doesn't respond, we can add a aminoglycoside, and later on maybe MRSA if someone has a catheter and other things. So computer G, can we have the answer, correct answer according to our computer and research data, which should be the most appropriate answer? Question number, I think it's the 13th question. So 48% of the students have correctly answered. It's a beta-lactam antibiotic. And computer G, can we have the winner for this question number 14?
I think, yeah, we have one.
Okay, we have Dr. Fanny Lewis. Congratulations, Dr. Fanny. It's a 14th question. You are still there. If you correctly answer next 6 questions, you will be the winner for this West Zone quiz. You still have a good chance. I request Computer G to also click the answer with the correct answer. I think we'll wait for Computer G to answer before speaking from the next question. Question number 15. Computer G. Okay, so question number 15. The following antibacterial agent cause QTC prolongation except macrolides, quinipristine, dalfopristin, fluoroquinolones, or a telavancin. Your time starts now. It's a except. Everyone causes QTC prolongation. Except one. Your time is over. So question was, the following antibacterial agent causes QTC prolongation except. So out of these 4, 3 antibiotics are causing QTC prolongation except for one. Computer G, can we have the correct answer? Okay, so answer was B, quinipristine and dalfopristin. These are the newer antibiotics, and we all should use antibiotic rationally. We should have an antibiotic stewardship program. Whenever antibiotics are required, then only we should use, because if you go to the studies and inventions in last 2 decades or 3 decades, I think less than 10 antibiotics has been discovered, newly antibiotics has been discovered. Out of them, this quinipristine and dalfopristin is also an antibiotic which has been recently used as a good MRSA cover or a methicillin resistant Staph aureus cover. And good thing is that it doesn't cause QTC prolongation. We all know that macrolides, azithromycin and all, can cause QTC prolongation. Fluoroquinolone can also cause commonly QTC prolongation. And this is another new drug, telavancin, which is also a good MRSA cover. I don't think it's freely available in India. Very few centers may be having this. So these 2 drugs are the B and D were the MRSA coverage for especially febrile neutropenia and patient having indwelling catheters. There only this should be used. Computer G, can we have the percentage distribution? How this was a difficult question of quinipristine, and the answer was B, and only 9.38 students were able to correctly answer that this doesn't cause QTC prolongation. So I think whoever has answered, even if he has taken 15 or 20 seconds, he will be the winner for question number 15. And Sai Prasant Janardhan, and it's surprising he has answered within 4 seconds. Congratulations, Dr. Sai Prasant, and he's again the winner for more than one fastest finger first. Congratulations, Dr. Sai Prasant.
Maybe remember from his Harrison, sir. The 20
Yeah.
seconds.
So I think we can have a tiebreaker because we have now only 5 questions, and 3-4 students are there who have correctly answered more than 2. And let's see.
Yeah,
We have
definitely.
if we have a tiebreaker, we can have 3 more questions for them, and it will be a good learning exercise. Instead of 20, they will have 23 questions to remember and to practice medicine with these new things which are discovered. So Computer G will give us the question number 16, and it will be more difficult than the previous one, I think. Okay, so which immunomodulatory agent shows anti-inflammatory activities by inhibiting tubulin polymerization, plays an important role in mitigating the cytokine storm? Is it A, interferon? Is it B, colchicine? Is it C, statin? Or D, A and C? So A and C club together. So it will be answer. Your time starts now. One of these drugs causes tubulin inhibition. Time is over. So this was another difficult question. As we come to the end of the quiz, maybe Computer G will give you a more difficult question. So which immunomodulatory agent shows anti-inflammatory activity by inhibiting tubular polymerization and plays a cytokine storm? You can see it's again another autoimmune process in which we have seen in COVID. Good number of COVID patients has a severe cytokine storm, and we did use a lot of immunologic drugs, and we have expert with us, Dr. Chandrasekhar, also to go through it. But first, we'll ask the Computer G to lock the screen for correct answer. Computer G, answer only. Okay, so answer was colchicine, and this drug is commonly used in autoimmune disease, especially gout. It's a very good anti-inflammatory drug, and it causes tubulin inhibition, and this may lead to improvement in fever and acute febrile response, as well as cytokine storm. As Dr. Chandrasekhar may have used hundreds of patients, maybe on colchicine under Dr. Chandrasekhar's treatment.
Yeah.
Sir, can you will you like
Yes,
to add
yes.
something, sir?
Yeah, colchicine is one of the very good immunomodulator. Especially this is the same mechanism for which we use it in gout when there is an acute attack of gout. And it is for the same mechanism for which we use sometime in dermatitis, especially associated with the henoxalin purpura, non-specific neutrophilic dermatitis. In those conditions where especially the neutrophil high drive diseases are there, it is a preferred drug of choice. Rather than using steroids, sometimes you can just do away with using colchicine. It really helps in those set of areas. So it's one of the less explored drug, no doubt. I think there was an attempt, especially being repurposed in, as you said, in COVID pneumonitis, where it could really reduce the cytokine storm.
Thank you, sir. So gout, it is commonly used, and it is also called, gout is also now called, I think, sir, autoinflammatory disease, and cause one of the diseases, inflammasome-associated disease.
Disease, yes, that's right.
So we have correctly answered, majority of the students have correctly answered, 69%, very good and really impressive. And can we have the winner for question number 16? Is another new winner, Dr. Uday Patel. Congratulations, Dr. Uday. And he has taken just 4 seconds to answer this question. Congratulations, Dr. Uday. So we are coming to the end of the quiz. We have 4 more questions. Best of luck to all of the participants. I still feel if someone answers all 4 correctly, fastest finger first, he can still be a winner, because we still not have any person who has answered more than 3 correct answers. Computer G will go for question number 17. Acrodermatitis chronica atropicans is a late skin manifestations of leptospira. A, B is Treponema pallidum, and C is Lyme borreliosis, and D is rickettsial Prowazeki. Your time starts now. Thank you, Computer Ji. Time is over. As I said, as we go to the end, questions will be difficult. And question was, acrodermatitis chronica atrophicans is a late skin manifestation of out of these 4 diseases. I think leptospira, you all know, common in India. I have not seen this term used in the leptospira, so this goes out. Treponema syphilis also is not a common manifestation. So out of C and D, one of this will be there. We don't have a 50-50 here. So we will ask the computer to just lock the screen, which is the correct answer. Okay, so it's a Lyme borreliosis, and correct answer is C. So Lyme disease is caused by borreliosis, and it's good thing that it is not very common in India. Very few cases has been reported. I also don't know why this is not very common in India because of temperature. We are a tropical country, more common in US, and this can cause a lot of problem in skin. And as per if anybody of our expert has any experience with this skin manifestation, acrodermatitis chronica atrophicans, if someone wants to add, you are welcome, sir. Lyme borreliosis and acrodermatitis chronica atrophicans. So we have answer to this question was C, Lyme borreliosis, and good number, 70% of the students have correctly answered. And can we have the winner for question number 17, Computer Ji? Fanny Lewis, congratulations. So Fanny Lewis also has taken just 4.
Dr. Penny has taken the lead from you, sir.
Again, a repeat winner for. Yeah, she is coming fast. I think best of luck to Dr. Penny also. And now we have 3 more questions, and Computer Ji will slightly increase the difficulty level. Computer Ji will go for question number 18. This is hantavirus. Hantavirus as a zoonotic rodent-borne virus belong to which family? So it's just memorizing thing. Is a nidovirus family, is a togaviridae family, it's a flaviviridae family, or a bunyaviridae family? A, B, C, D. Computer Ji, time starts now. Time is over. So this is hantavirus, is a zoonotic rodent disease, and this can cause pulmonary renal syndrome. This can cause viral hemorrhagic fever, and this can lead to death also, and good case fatality. Good thing is that it's not, it has not taken a pandemic proportion like our COVID, and although some cases of person-to-person transmission has been reported. So which family, Computer Ji will tell us out of these family, which family does hantavirus belong? Computer Ji, answer to question number 18. Okay, it's a bunyaviridae family, and if I remember, a few more viruses which are notorious in this family will be a Crimean Congo virus disease, which is again another viral hemorrhagic fever, which can get infection by aerosol, and cases has been seen in even Gujarat, and some cases has been seen in even Kerala. So Computer Ji, how many students have correctly answered? Correctly, 47. Again, majority of the students are correctly answering, and we can have a winner also for question number 18, Computer Ji. Majority of students are correctly answering, even if difficulty level rises with question number. So hantavirus disease causing bunyaviridae family. Dr. Dheeraj Kotwani, again, congratulations, Dr. Dheeraj. He has also good chances of coming as a winner or a first runner-up. Congratulations, Dr. Dheeraj, and he's answered within 4 seconds. So we have left with 2 questions only. We'll go to the penultimate question. Dr. Computer Ji will go for question number 19. Okay, so demonstration of halo sign or a crescent sign on CT thorax of a patient who is persistently neutropenic is indicative of what infection? Is it invasive aspergillosis? Is it histoplasmosis? Is it mucormycosis? Is it PCP? Your time starts now. We have a lot of questions on neutropenic patients who are immunocompromised. Thank you, Computer G. So time is over. This was the penultimate question before the ultimate 20th question. And this suggests that what do you mean by halo sign or a crescent sign on a CT thorax? I think most of the medicine students who are seeing critical patient in ICU and all, they all know the importance of CT thorax, especially when you have a fever of unknown origin or patient has a severe neutropenia. These are the patients who can develop a fungal pneumonia, who can develop a PCP pneumonia, or who can develop a very atypical nocardia infection also. So crescent sign is very typical of one of the fungal infection, which is just necrosis. There's a nodule there which get necrosed, and you have a crescent or a half moon-like feature is there. If that is there, radiologists give you a clear-cut diagnosis that it may be a fungal infection of specific origin. Computer G, can we have the answer? Computer G, answer to question number 19. Is it aspergillosis? So yes, it's an invasive aspergillosis, which is commonly present with nodules all over the lung field. And some of the nodules can cavitate by necrosis, and they give you a sign like crescent sign, which is common in aspergillosis. While similarly, inside that necrotic material, there may be a fungal ball also, which is also called aspergilloma. But this is invasive aspergillosis where you need a chemotherapy. So role of CT comes very important. Clinically, you by auscultation and blood tests, it's difficult to diagnose these cases. So CT has a severely sick patient and a neutropenic patient. We'll go to the last question. Or sorry, we'll have a
we have got majority of them answering.
question 19. 71% of the students are correctly answered. It's very impressive. I think you people do know radiology and what is the role of these imaging. I'm really impressed. Congratulations. So we will have
the winner here, sir. Dr. Hemant Paikro.
I think Dr. Hemant.
Congratulations. Yeah.
I think Dr. Ramesh Agarwal, if you are there.
time fastest finger is missing here, but okay. So yes, 3 seconds. It's a very fast. I think one of the fastest finger by Dr. Hemant. And now we have a last question, and we have to give 2 trophies for zonal quiz, first and second. So best of luck to all the students who have answered correctly till 19th question, and best of luck to everyone. Computer G, we'll go for the 20th question. This is the final question. Femister triad, all are true except, just remember except. Juxta-articular osteopenia, osteoporosis is present in Femister triad. Peripheral osseous erosion is part of it. Gradual narrowing of joint space is a part of it, or a seen in HIV-associated arthritis. Which of them is not correct? Your time starts now. This is the 20th question, last question. Best of luck to everyone. Okay, so time is over. So I think we have completed 20 questions, and this is the final. The Femister triad is a difficult triad. We all are very good at making triads and naming those signs. And this Femister triad is commonly seen in tubercular arthritis. So in these patients, you have juxta-articular osteopenia or osteoporosis. Peripheral osseous erosions are also there, and gradual narrowing of the joint space also there. So all tubercular is not HIV. So I feel answer will be D. Computer G, is it right? It is tubercular arthritis triad, trimester triad, and it is not seen in HIV-associated arthritis. So answer D was the correct answer. You can say the wrong answer. All three are present in trimester triad. Computer G, can we have the distribution of percentage of correct answers for trimester triad? So 51%, majority of the students are again correctly answered. So I don't remember, I think maybe one question, the majority of students were not correct. All the questions were 95% students are correctly answered, most of the questions. So Computer G, we have a winner, Dr. Saraswati Rajput. Congratulations, Dr. Saraswati, for winning the final question, question number 20, and she has just taken 3 seconds. So we are over with 20 questions. We are closing this. Computer G's will do the calculation and will tell us who is the fastest finger first. Even if we have one winner, if second, there's a tie break for second position, we will have to run 3 questions MCQ for those tiebreaker. And I will hand over the stage to Fever Microcon team to continue with that till computer do some analysis and give us exactly who is the winner and who is the runner-up. Dr. Karthik and
Thank you.
Krishna,
Yeah,
Dr. Manjula can take over from here. Thank you, ma'am.
Thank you. Thank you so much, sir. It was wonderful. It was really great, and you did it single-handedly. It was wonderful. So, Dr. Chandrasekhar, sir, you would like to say anything, final words before we have
I think it was very wonderfully organized. I should congratulate and thank Dr. Ghanshyam. He has really taken it so smoothly and so nicely, explaining every aspect of the quiz. So, I mean, I could really see the answering profile of our postgraduates. I mean, it was really very good. I think I could see in majority of the questions, good proportion of the patients, good proportion of the students had answered it right. No, that's really good. So that puts us to say, I mean, into a very good scenario that yes, our students are really working hard and doing a real good job. I think I should also say that in one of the questions, which was news based, the answers were where we were expecting 100% was lesser. So I think they are reading more books than the papers. I mean, that's good.
That's true. Thank you very much, sir. Dr. Anupam Prakash, sir, from Judges.
Well, a very good evening to everybody, and I congratulate every participant who has actually participated in it. I would say participation per se requires a lot of courage, and everybody who is participating deserves credit. You may or may not get the award, but participation in itself is very significant. And I think this is a very good event from Fever Foundation and FEFCON, that they are organizing an event because of the internet facility now available with everybody, and people are able to attend these quizzes and programs from home, which is a very big achievement, I must say, because it becomes very easy for students, and it is a launchpad for you to participate in future programs, even in live sessions. So that is one thing. So I congratulate FEFCON and all the participants. So everybody deserves credit. Then the next I would say is Dr. Ghanshyam did a wonderful job.
Yeah.
And he has always been very, I would say, academic and entertaining. And he has that aura with him. And the way he presents, I don't think he is no less than AB doing this KBC type of thing. So that was wonderful because he had all those things and art in him to conduct this quiz. So again, hats off to Dr. Ghanshyam. And again, I would say to the audience, the participants, that is a very important achievement, I would say. Many questions, as Dr. Chandrasekhar was also saying, that even a question which appears simple and in the news, at times we know the answer, but we have a doubt creeping in our minds and we make it wrong. This is natural for everybody. And I think those who know the answer or get confused at the last moment. So the stem is derived, the choices are designed like this, that yes, at times they are very intricate and they do confuse you. So that is one thing which you should not get disheartened with that. So questions will come and MCQs are at times made like that, that you will get confused seeing them because you have read all the things and at times it becomes difficult to answer those things. So that is another thing which I think the participant should always remember and not get disheartened. And even when the results will be declared, I'm sure there will be some very near misses. And that again, I would say is very important because near misses are things which make you practical oriented. And in life also, you have these near misses. So it is just like you say that the bullet passing through just near you, next to your pinna or ear. So those are the things which I would say these are very important things for all the participants. And we also learn and the variety in the MCQs answers that we have. So you have some A's, you have some B's, you have C's and D's. So you see, it just acts like a pyramid. In fact, the Dr. Chandrasekhar was talking about that question. You could see the answers were also in a hierarchical way. So A was less, B was more, C was more, and D was still more. So that is actually a representation of the population in general also. So you know that yes, there are people who will have majority may have a belief, so they may be majority may be wrong at times also. Majority may be right also, and at times there could be an equal amount of two answers which people think. So at times our teaching in our colleges or our orientation may not always be the correct perception. So MCQs actually gel you well, but yes, there are some people who master that art of answering. But yes, I would again give credit to Dr. Ghansham because there were some questions. There was one question which had choice of A, B, C. C was A and C, A, B, C, and D. D was choice A and C, and neither A nor C was correct. Usually it is A or C would be correct. So people actually fill up that MCQ that yes, A or C is correct or A and C is correct. But the choice was actually B. The correct answer was B. So these are interesting things, and that tells you about what Dr. Ghansham's mind is, and he reads the mind of the participants also. So credit to participants and to Dr. Ghansham also. Well, thank you so much. I think I have spoken a lot.
No, sir. Thank you so much. Dr. Ramesh, sir, you would like to say, or before we make some poster announcement?
Yeah, I think, ma'am, Dr. Anupam has very rightly highlighted the importance of this quiz, that it makes the students more competitive, and winning or losing is not the question here. The participation is more important. And many congratulations to quiz master Dr. Ghansham, who single-handedly has taken both the computer G and the students along and conducted the quiz in a very nice way. Yes, ma'am. Over to you, ma'am.
Thank you very much, Anupam sir, and Dr. Chandrasekhar sir as judge, and Dr. Ramesh Agarwal and Dr. Ghansham sir. Sir, you rocked. It was wonderful, and really it was a great. So now for all the participants, I would like to inform that we are going to be doing another scientific event from the Fever Foundation, which is case presentation competition. We did it last year. Same way this year also we are going to do that. So this will be in the electronic form only. We only accept electronic form of the posters. No physical copies or even the photograph of the physical posters are not allowed. So it has to be the e-poster, and we will be sharing the format. It will be one PPT slide poster, and the format will be available to you once you at the time of registration. You just download the format. In the same template you will be uploading the posters, and then all this poster should be it can be a case based you can I mean you can submit a case based poster, or it can be your original research based poster. And then our judges will, when you download, when you are uploading your registration form, you will see two download buttons where you can select whether it's a case based or it is a research, which where you will be competing. And then we have a scientific committee. They will be screening all your posters, and they will call the top 10 posters for making the presentation. And first author will be asked to make the presentation, and your posters should have but the title of your poster should not be more than 15 words. And along with your one slide PPT, you will have to also submit an abstract of or an article which is about 500 words. The format which you have to use is the JAPI format, the Official Journal of Association of Physicians of India. Also will be done, and the dates and other things you will be in the live link which you are going to get it. So I request all of you to be ready with your cases for uploading, and then there'll be award for the winners as usual. So thank you very much. If everyone is ready, we are waiting for the winner. I would like to ask our IT team, is it ready that we can announce the analytics is over? Can we announce the winners?
I hope it's not a tie break. Okay, we have a clear winner. Great.
Yeah. Gansham sir, you can announce.
Congratulations. We have two winners, first and second for West Zone. First place is for Dr. Dheeraj Kotwani. He's from College of Medicine, JNM Hospital. I'm not able to exactly make it out which exactly place is this. Maybe Gujarat only or Ahmedabad. And Dr. Aman Pandey, he's from Gandhi Medical College. Both of you, congratulations and best wishes for winning the final also. And you will be invited by our Fever Foundation team to Bengaluru annually. I will love to meet you, Dr. Dheeraj and Dr. Aman, and we will give you best wishes to winning the final event also, not only journal. And I think Fever Foundation will meet you maybe tomorrow to just give you some bouquet and maybe some chocolate for winning the event. Congratulations again. Best wishes to you both.
Just one to add, sir, Dr. Dheeraj and Dr. Aman, first of all, congratulations. Secondly, both of you will be playing as a team. You will be representing the West Zone. You will not be playing individually in the finals. You will be playing as a team. So we will be sharing the contact details of each other. Please prepare as a Western Zone team, and you will be competing with other zones for the finals. So I wish you all, both of you, a very best wishes, and please come out winners once in the national competition. So anybody would like to?
Welcome to Bangalore.
Before, welcome. You'll be coming to Bangalore on November 5th and 6th, where we are.
Yes, I just want to add one point,
ma'am.
The same participants, they can view the tomorrow's and day after tomorrow's quiz through YouTube. North Zone quiz and South Zone quiz, they can view in the YouTube. Another 40 questions and another good learning. So I would invite them, and they can contact our, we can send the link through the email itself.
Yeah,
the YouTube link, which they can watch tomorrow and day after.
So what sir, Mr. Jairaj was saying, you can view the other zonal wins. You cannot participate, but you can view them so that you will know other questions also. So it will be a learning process for you all. Right. The judges and the quiz masters, yes, sir, please go ahead, sir.
Your foundation team will meet you, and maybe also our computers will like to see your iCards also. Okay, best of luck.
Right, good.
So if the judges and the quiz masters are allowing us that, sir, can we close this live session?
Yes,
yeah.
Yes, please.
Thank you very much. Congratulations, and also congratulations to all the participants. Okay, maybe one or two, all of you are winners, because the way you were answering with a short period of time, and it was wonderful watching you all, and I hope you had some learning as well in this. So as everybody saying, participation is more important than winning. That itself is really a great achievement, and congratulations to each one of you. Thank you very much, and good night to all of you. Best wishes.
Good night.
Good night. Good night.
Good night, please.
Harshit, stop recording, please.